Welcome to this interview with Dr. Angela DeLeon. We'll be discussing her recent research on vegetable consumption and dietary guidelines. Angela, thanks so much for being here.
Alistair, thank you so much for providing this opportunity to talk about my research. I'm very excited to be here.
Thanks. Angela, the health benefits of diets rich in fruits and vegetables are well established. Can you first tell us a little bit about your recent study? How did you design the randomized control trial that formed the basis of your study? And also, what new information did you uncover?
The original study, which was a larger, we call it a parent study, was really designed to look at the question, if you simply repeatedly exposed low vegetable consumers to vegetables and the types and amounts recommended by the dietary guidelines for Americans, would this increase their motivation to consume vegetables? So the design of the study was a randomized controlled trial. So it was a 16-week study in which the first phase of the study was the active phase. So basically, people who self-identified as low vegetable consumers, which basically meant they consumed one or fewer servings of vegetables per day. They were recruited to this study. Half of them were randomized to a vegetable intervention in which they received minimally prepared, cleaned, prepped, fresh or frozen vegetables for home consumption for 8 weeks. The other half of the participants were randomized to an attention control group. And what that means is they did not receive vegetables, but they attended the same number of visits to the research center. They received the same amount of attention from research staff, so as to eliminate a kind of a bias where one group would have the social interaction and the other wouldn't. So then the second half of the study was a follow-up phase. So neither of the groups received vegetables, but they still continued to come to the Center for Assessments. And that was a secondary question, was to see, would the exposure to vegetables lead the people in the vegetable group to want to continue to consume vegetables? So what would happen to their consumption when they were no longer receiving them? Then that started in October of 2015 and completed in 2018. But this was really interesting. Partway through the study, research was coming out that we became aware of that was starting to show an association between fruit and vegetable consumption and psychological well-being. So imagine that this is a game changer. All of the information, all of the guidelines for fruit and vegetable consumption has gravitated towards risk reduction or prevention of major chronic diseases, as you mentioned. Things like cardiovascular disease, type 2 diabetes, certain cancers, certain inflammatory conditions. Now there's researchers coming out showing, wow, not only is fruit and vegetable consumption associated with psychological well-being, but it's occurring in a much shorter time frame. One of the reasons people have a hard time prioritizing fruit and vegetables is the benefits are so far out in the future. You know, I did another study where we actually asked people what makes it hard to eat the recommended amount of vegetables. And some people said, well, I can wait until later. They actually believe that they can wait until they're later in life to start eating well to prevent chronic diseases when these diseases take decades to accrue. So imagine something showing that simply eating fruits and vegetables can make you feel better about yourself in a matter of days to weeks to just, in one study, they followed people over 7 years. So that was the impetus for the second study.
The term SHS, how does SHS work and what is it used for?
That's a great question. So the SHS stands for the Subjective Happiness Scale. So one of the definitions of happiness is how one judges the quality of his or her life as a whole. The Subjective Happiness Scale was designed exactly to answer that question. How satisfied or how happy one feels about their life considering everything. The reason we chose this particular scale is because, well, if you look at the literature, one review article looked at 99 different measurements of subjective well-being, because the parent study had already started and it was already heavily loaded with questionnaires. So as I mentioned earlier, the main question was just, would simply exposing people to vegetables increase their motivation to eat vegetables? Beyond that, the study aimed to look at secondary outcomes. So what could be potential moderators? So for instance, how you score in a 3-factor eating questionnaire. Are you somebody with high dietary restraint, disinhibition? Are you overly susceptible to perceptions of hunger when you're not really hungry? So a number of other questionnaires were already included in the original study. We were looking for a short, sweet psychometric tool that would not add to the subject burden, but which was also very highly validated across 14 studies. And it exactly asked the questions we wanted to know without many of the other questionnaires also asked people to reference memory. So in the last month, how many times did you feel X? Or how often did you feel Y? This question is just considering everything. How happy do I consider myself to be on a scale of 1 to 7? Not at all or very. And so that was the level of the questions. So it was precise. It was not adding to the subject burden. It's also a very well validated tool. It has very high internal consistency, meaning that when people are asked if they understand what the questions mean, people do. So also, and this was also very important for this study, it had very high test-retest reliability, which basically means it's intended to be a very stable tool, right? So if we show differences from the beginning to the end of the vegetable intervention, we likely have underestimated the effect size.
And in our average Western diet, is it fair to say that we probably do not consume enough fruit and vegetables? And if so, how do we increase intake?
You are absolutely correct. Not only in the US, but there have been studies that looked globally. Most societies do not consume the amount of fruits and vegetables. So the reason we have these recommendations, just to take it all the way back to the beginning, we know from large population-based studies that people who have the highest intakes of fruits and vegetables have the lowest risk of chronic diseases. So there is a certain threshold that one needs to consume to accrue these benefits. And for instance, in the United States, at the time the study was started in 2015, it was estimated that only 9% of the population met the recommendations for vegetables. 4 years later, the study was, it's basically an ongoing study that reports come out every 4 or 5 years. That needle had not moved. And in fact, there was another study that reported, actually, this was a report from the Centers for Disease Control and Prevention, their morbidity and mortality weekly report that comes out. And they basically said that since 1988, fruit consumption had not changed in the US, and vegetable consumption had actually slightly decreased. So how can we improve the situation? Well, I think one great thing would be if the word got out there, like, eat veggies, be happy. That could be a start. But some strategies that have been, tested and shown to be, have a good evidence base for success are things like increasing the availability of retail stores, markets, grocery stores, in certain areas where there are none, so that people have access to fruits and vegetables. There have even been experiments with mobile markets in rural communities that have shown some success in increasing fruit and vegetable consumption. For people in the lower income situations, making them aware of national, federal, and state food assistance programs, like the Supplemental Nutrition Assistance Program for people who are within 130% of the poverty level. And there's also another program, a national program for women, infants, and children that also provides support for nutrition. Also increasing nutrition education in schools that has been shown to be very successful in increasing consumption of vegetables, fruits and vegetables in school-age children through nutrition education classes, cooking classes, school gardens, Also increasing availability of home and community gardens, providing people with the tools to do that. Another study that we did, people talked about not knowing what the guidelines are. So putting the word out there, like how to get access to this information, increasing the availability of fresh fruits and vegetables in work sites, hospitals, universities, even sporting venues. So basically just making it more accessible to people where they are. Because the fact of the matter is more people are not cooking at home anymore.
Yeah. And those guidelines, are they, in your view, sufficient? They're just not getting out there, or they're not being followed? Or do the guidelines potentially also need adjustment?
That's a great question. I think the guidelines are, they're, I think, sufficient. They're really only meant to be guidelines for quote unquote healthy people. And they're limited in that they're only based on age and energy needs. So first of all, most people have no idea what their energy needs are. So, you know, it's like the food labels here in the United States. They have a percent daily value at the bottom. It's based on a 2,000 calorie diet. What percent of the population do you think fits into that narrow little strata? But beyond that, and this I think is another issue that has really come to light, I think, in the last couple of years because of COVID, is that the current iteration of the dietary guidelines and the accompanying graphic, the My Plate that goes along with it, is only available online. So we have a digital divide in this country. When COVID shut down all the schools and students were required to learn from home, it became glaringly apparent that a large swath of the US population has no access to broadband and or have no home computers. So in the same surveys that showed that only 10% of the US population meets the recommendations for vegetables, those same reports all report that people close to or at the poverty line consume the absolute lowest amounts of fruits and vegetables. And why is that? It's because the elephant in the room in the US anyways is this glaring income inequality. You know, that's not something the dietary guidelines can fix. You can recommend all you want, but if you are food insecure, you know, meaning you don't know if you have food from the beginning of the month to the end of the month, you're going to choose the food that provides you energy, not necessarily nutrients. And beyond that, I just do have to say this, this is actually really exciting. Moving beyond the guidelines, the field of nutrition is really moving towards precision nutrition, or what they call personalized nutrition. And so this is a sort of moving towards where we're going to be able to prescribe an individual a diet that meets all of these other factors. So it takes into account genetics, it takes into account physical activity level, body size, race, ethnicity, and environmental concerns.
Thank you so much, Angela. It was great speaking to you, and let me wish you all the best of luck for your further work. Thanks a lot.
Thank you. Thank you so much for this opportunity, and I wish you all the best of luck to moving this forward. It's a great platform. Thank you.
Thanks.